Hi, everybody. Welcome to Broad Banter. We are so glad you're here with us today. My name is Jahan Corbin. This is my dear friend and fellow breast cancer survivor, Lynn Haddad, and we are honored to be the co-host of Broad Banter. If you're not familiar with BRA, it is an acronym that stands for Breast Cancer Recovery in Action, but we call ourselves BRA, and you can insert all your supportive puns there. There's lots of jokes to be made, but we are first and foremost a community of and for breast cancer survivors, and we are a nonprofit in the Middle Tennessee area. We I kind of like to say that we have 3 E's. We offer exercise classes that are in a small group setting with a personal trainer twice a week in various places in the community. We actually have 11 groups all over Middle Tennessee. We also have education, which Broad Banter falls under that umbrella. We have things like lymphedema education, nutritional education with a registered dietitian. And thirdly, and what was most significant for me personally, is we have emotional wellness. And that is a small group that's facilitated by 2 survivors. And we work through a curriculum that's tailored around processing the emotions that come with a cancer diagnosis. It's one of these clubs, everybody on this call understands it's a club nobody wanted to join, and yet here we are. And there's a lot of feelings and things that come with that, whether it's while you're going through treatment or sometimes it's much later after your treatment. And so dealing with that emotional component was really significant for me personally. And so I feel really passionate about providing that for other women. All the BRA resources are available for free, and we are grateful for the generous donations of people who help us provide that for free. So if you're interested in learning more or want to participate in a BRA group in your area, please go to our website, bragroups.org. And that's also how you can listen to this banter, but we hope that we will get to meet you in person soon. So thank you for joining us. I'm going to turn it over to Lynn to introduce our topic and guest speakers today.
Yeah. So thank you very much, Jahan. Always a pleasure to be here. Today we will be discussing businesses that have been founded by breast cancer survivors. So we'll be talking with Erin and Angela about, you can see the sign behind them, Good, Better, Best. And we'll be talking with Candy, I don't know, actually, I'm looking at the gallery view. Sorry, that's a little blip. Everybody might not be seeing the same view as me. It just occurred to me. Anyhow, we'll be talking with Erin and Angela, who founded Good, Better, Best. And we'll be talking with Candy, who founded Ribbons and Roads. So you 3 are the first 3 that are also going to be members of our Warrior Women series, which is a series where Jahan and I will be talking with breast cancer survivors to learn their personal stories and to learn how they have overcome their breast cancer diagnosis and done amazing things with their lives. And so thank you, all 3 of you, for joining us. I'm a little off my game today.
We do have somebody that will edit some of this too. So if you are like, what are they doing? Don't worry.
It's actually the 3rd banter of the day.
Yeah, it's okay.
I feel like
it's all good. It's all
might
good.
need a little sugar.
Or coffee.
Don't mind us if I unwrap some chocolate in the middle of this.
So we are going to be starting with Candy Hunley from Ribbons and Roads. So I would appreciate it if you could get us started by sharing just a little bit about your diagnosis, and what you've been doing in the year since you were diagnosed almost 20 years ago, I believe.
Yes, it's July of 2005. I was diagnosed. I was 36. I had 3 small children at home. And it just came out of nowhere and no history in my family whatsoever. So I found the lump and I'm like, yes, that's cancer. I just knew right away. So I went through just a bilateral mastectomy, reconstruction, chemo, radiation, all of that. And, just got to the other side of it and thought, I just always wanted, I knew I was going to give back to women. I wanted to help. I just didn't know what that looked like. And a few years after my reconstruction, which is never an exact science, it's not, it just isn't. Once they've done reconstruction, you just to be completely symmetrical, it's just not an exact science. So I was really struggling with my clothes and just feeling good about myself in my clothes and just every day just getting up like, okay. So just struggling with it, what that looked like. So Pam Ludwig had just opened Pretty in Pink in Franklin, and my nurse navigator, I went to my nurse just for my annual checkup, and I was talking to her, and she said, you know, this woman just opened a company to help women with breast cancer items, bras, and prostheses. Why don't you just go see? So I did, and I went to go see her in oh my gosh, I guess it was 06 or 07, and just as a patient, and she helped me out, and it was just like, okay, that was very, very helpful. Plus she billed my insurance, and I thought, okay, wonderful. And but it always just stayed with me. Like that was just something. And then when I was ready to kind of get back into the workforce, I called her, and she was actually opening a store in my city in Columbia. So I thought, all right, well, so I came in, interviewed, got hired, and worked there for 11 years and just learned the business from the ground up. And just was helping women every day in their journey and their walk with fittings for bras and prostheses and post-op camisoles. And then once I left, I was with them for 11 years. I left in 22. I thought, okay, I'm just going to take some time. And then when I decided what I wanted to do, I wanted to do the same, but I wanted to go to the women. So that's how I started my company. I want to be able to go to the patient to help them so they didn't have to, whether they weren't feeling well during treatments, or they couldn't, they had to wait for a ride from their daughter-in-law or their daughter, whatever. It was just, I had so many patients just in the, years I worked for Pretty in Pink. They were just like, can you come to me? Could you, whether they were at the hospital or at their work or at their home, and they're like, could you come to, and that just wasn't a service that, they offered. And I just always remembered that it was just important. And so once I started like, okay, what do I want to do? And that's what I wanted to do. I knew I wanted to do it. So I own Ribbons. I started Ribbons and Roads last year. And so I have a mobile van that I have wrapped with my logo. And so I'm able to go to the patient to their home or wherever they need, just in the privacy of their home, and do a private fitting for their items, and to be able to bill their insurance as well. And
Gosh,
it's been incredible.
I'm picturing like a pink van. What color is
It's
this
it
van?
is actually, it's not, I will tell you, I didn't want like pink.
Right. Like
It's like
Mary
a
Kay.
muted pink. It's a very, yeah, it was very important to me not to be like the true breast cancer pink,
Sure.
just to see me coming, but it was also, I wanted to be in that realm, but
I feel like I'm going to see you on the interstate and be like, there she is.
you will, yeah.
Okay, well, we are so excited to delve into that more and learn more about what you're doing. Let me back up just a couple steps and and just ask you about I think you said 11 years with Pretty in Pink, because that's where you really learned the business.
It is.
And got to know the fittings and the prostheses and the gear, the sort of post-surgery stuff that you need. I know, just from my own personal experience, I didn't even know. It's like you don't know what you don't know, right? And so I didn't.
Exactly.
So I went before I had surgery by myself. I had an appointment, and I showed up to be fitted for some post-surgical bras. And when I was done, and they were wonderful, and the people that I went to were great and knowledgeable, very kind, all those things. But when I got in the car, I cried, because I remember thinking like I should have had somebody with me. And it never occurred to me to ask a friend or my sister or somebody to go with me. I wasn't counting on there being so many emotions around that, and just even being in the store where there were wigs and different accessories sold, and I wasn't quite there. I knew I was headed in that direction, but I wasn't there yet, and it really affected me emotionally. I say all that to say I can only imagine how impactful the emotional work is that you're doing, as well as the physical fittings. I mean, do you feel like you're counseling a lot of these people as you
Absolutely, yes.
especially since they know you're a survivor and you've been there?
Yes. And I don't share my story with everyone. I think that's really important to me. I let them guide to determine, like, is that something I want to share? Is it, will it be helpful? And, just, it just kind of depends on, each woman, but absolutely, it's very emotional. Once you've walked this journey and you've been through this, I mean, exactly. I love what you just said. You don't know what you don't know. And you walk in, like I remember going into the doctor, and when you get that diagnosis and they say the word sentinel node, I'm like, what's that? What's that? What's what's BRCA? I mean, all of these words, you're like, I don't want to know these words. But now, 20 years later, I'm so thankful I have 20-something-year-old daughters. I'm like, I'm so thankful that I can have discussions with them and just patients as well to say, just things to watch for and things to know, just knowledge. Again, knowledge is power, and the more we know, the better. And just to get the information out there to women and to other, whether they're survivors or not, just like it's just important, so important. And with my company and with what I do, even after this many years, I actually had a patient call yesterday. So she was diagnosed in '04, and a much older lady, and she had gotten my information from her surgeon, and that I had been visiting some local doctors here to give my brochure and just let them know that I'm available. She didn't know. She did not know that that was an option. She had no idea that she could get bras and prostheses, and she's been using a sock for 20 years.
Oh,
Oh my
And I
goodness.
can't tell you guys the stories over the years that I worked. Oh, a sock is, I'm telling you, I've seen rocks, I've seen sand, I've seen
Oh my,
rice. I mean, the things that people will do
oh,
to to help themselves that they didn't know. So it's getting the word out there, not even just to the patient, to the doctors, to the
yes.
yeah,
surgeons, to let
Yeah,
them know. A lot of them don't even know insurance will pay for this depending on their policy.
right,
and
right.
it's
And
expensive,
it can be very expensive, absolutely. And if their insurance covers it with a prescription, we can bill their insurance just as if they're getting their medicine or they're
Right.
getting that doctor
Right.
visit. We can take care of that.
Well, and
So,
depending on the person, like you said, I mean, it goes back to that emotional impact. There can be so much tied up into our symmetry and our
mhm.
femininity. Like there's, I mean, for different people, it's a different
right,
level, right? But I
right,
mean, I can't speak for everybody, but I just think that's to your point. People will go to extremes to try to figure out a way to make them feel
Yes.
better in their own
Yes.
clothes.
Yes,
And that's,
because they don't know. They don't
they
they don't
don't
know.
know. Right.
So,
Right.
but now she knows, and she's like, I had no idea. And
Bless
she
her
was, I
heart.
mean, she's 80 years old, and she's like, I've been doing this for 20 years. I had no idea. And she's right down the road. And she said, I've been going to this surgeon forever, and he didn't know that was an option either. And it's like just getting the knowledge out. It's just so I'm so thankful that
Yeah.
I'm doing what I'm doing.
Well,
yeah.
we are too. So walk us through, you left Pretty in Pink. You always knew you wanted to start a business.
Mhm.
Sort of the how did you pull the trigger last year? Like what happened that led you to say, this is it, I'm gonna do it right now?
Uh, you know, it's funny. My daughters and I were talking about we were just kind of going back and forth about, what I wanted to do, and I knew I wanted to do something like that, and I just kept bringing it up. And then once we started talking about if I did it and if I got a van and I went to their home, we started talking about names. And it's almost as though when that name came to fruition, that's when I pulled the trigger. I'm like, that's when it all came together. It was like, that's what I'm doing. That's it. And it's ribbons because it's breast cancer and, but also the road because I'm on the road. And when I had someone create, I had a graphic design lady I hired create my design, and
Mhm.
she emailed me the design. I'm like, that's it. I just knew immediately. Yeah. Hmm.
Right.
Good.
Well, and I think you mentioned when we did our pre-call that you had been involved in a lot of different business, like running the business aspects for Pretty
Yes.
in Pink.
Yes.
Because you are able, I believe, to bill insurance and you've hit the ground running, I
Yes,
think,
I did.
right?
Absolutely. Yeah. So I've got I do Medicare, Cigna, and Blue Cross are my contracts right now that I can bill. And of course, self-pay. And I'm
Right,
working on getting, other insurance policies as well,
right.
contracts, so I can help bill other patients.
So, I mean, that's half the battle, right? There's one side of
Absolutely.
the coin is having the vision for what you want to do, and then the
Right.
other is actually being able to make it happen.
Yes, yes.
And
And
it
to
sounds
be
like
able
what
to
they
be accredited I'm considered DME, durable medical equipment, and to be
uh-huh.
accredited, you have to have a brick and mortar. I can do mobile, but I have to have a brick and mortar. So I have an actual store as well in Columbia.
Right.
Great.
So if a patient wants to come in there for a fitting.
That's what I was gonna say. So is that open like set number of hours per week or how?
Well, yes, I have to be open 30 hours. So I have a receptionist. So she, I don't have anyone manned as far as to do fittings, but if someone comes or calls, we can make an appointment and I would just meet him there for now. Eventually I'm hoping I can, absolutely have someone there to do fittings, but
Right.
it's just me right now, just little old
Right.
Yeah.
me.
You're a one warrior woman show.
Yes, I am.
So tell us about the mobile aspect. What's the radius right now? Or are you just, I'm just curious, like, where are you hearing from? Where are people from that are calling you? Are they all over?
They're yes. Right now, I'm staying in Middle Tennessee.
Okay.
So I've been to Waynesboro, I've been to Hendersonville, I've been to Murfreesboro, Nashville, Lewisburg, Chapel Hill. Just kind of all over. So right now, I'm trying to get the word out, just local, and I'm in Murray County, and
Uh-huh.
so I'm just visiting breast surgeons and general surgeons around here just to get the word out, and that's been amazing. I mean, I hit the ground running with lots of referrals already.
Yeah.
So, yeah.
That's incredible. And you said word of mouth and like how, and you're also trying to promote to the medical offices so they know to refer you as well.
Yes, absolutely. Yes. And I'm working with, I've got two of the girls I worked with at Pretty in Pink. They have my brochure. I
Right.
have their brochure. So it's like I had them call one day and they're like, would you go to Waverly? Well, that was a little too far.
Right.
But it was just like, that was awesome that they called because I had a patient that didn't want to drive that far. So I was like, that's great. Well, then I've also had a patient who was heading to Franklin. I'm like, go see Pretty in Pink because it's
Yeah.
just the best of both worlds, and I don't do compression right now. They
Yeah.
do compression for the compression garment. So I'm definitely doing a lot of referrals for them to get that business.
Right. Yeah.
Okay.
All right. So you don't do
That's one
compression
of the things I was
sleeves,
gonna ask
right?
you about.
Yeah.
And so how far out, I mean, it may vary depending on the season, but do you, like, if somebody's listening to this and they want to give you a call, are
Mhm.
you booked out several weeks
No,
or?
about a week right now, about 7 to 10 days. Yeah.
Yeah,
Yeah.
so you're able to get people in pretty
Yeah.
quickly.
Yes. Yeah.
Okay, that's fantastic.
Yeah.
What do you think is the most rewarding part for you to work with these ladies?
So that'll make me tear up. But just the other day, I had the sweetest lady, and so she had had her surgery about 2 months ago, and it was just very important to her. She had unilateral, it was just one breast removed, and she was just like, it's just important when I go to church or when I go to the grocery store, and just seeing once you put that on, and they put their shirt on, and they're just the tears in their eyes. That's just so rewarding. They just feel like themselves again. Yeah,
Yeah.
That's awesome.
It is
Yeah, that's
wonderful.
great.
yeah.
All right. Where do you see Ribbons and Roads in 5 years? I think you
Oh
talked about
gosh.
expanding, but 5 years is a lot of time with the way
It
you.
is a lot of time. I would love to have a few vans in the area. I would love to have, my store rocking and rolling with someone there, a couple people there, and a couple vans just going further. I'd love to be in East Tennessee, West Tennessee, and just, that's the goal. Just continue to expand and help as many women as possible in the privacy of their home. That's just, so they can feel comfortable and they don't have to get out if they can or they don't want to, and I'm able to. So that's the goal.
I love that, and I can
Yeah.
totally see it happening, especially since you've started just like gangbusters in this
Yeah.
last
Yes.
year,
Yes, I
and
I
know.
you've
know.
especially. I know the five of us on this call as survivors. You were talking about being in somebody's home, not only the comfort and privacy of your own home,
Mhm.
but when you are going through active breast cancer treatment, you're so at the mercy of the doctors and their schedules. And it's like I
Yes.
felt like I was. I mean, I'm in Williamson County. It's not like I'm that far, but I was driving to downtown constantly for appointments.
Hmm.
So to have somebody come to me feels like an absolute luxury and treat.
Right. It
You
does.
know,
Yeah. Yeah.
even if I have to do this and I don't want to do it, but it's like
Yeah.
it's such a treat. So
It is. Yeah.
I love what you're doing, Candy. You're
Thank
you're a
you.
spitfire. I love it. Thank you
It's
so
amazing.
much. Thank you for
Thank you.
sharing with us.
Yeah.
Thanks for sharing your story.
So on that note, we're going to chat with our second set of warrior women today, Erin and Angela, who are here with us from Good, Better, Best. And if you are watching this call and can see us, they have on fabulous matching jackets, and their logo is in the back. And
I'm just so dazzled by.
I mean, I love them already. I just can't know them, but I already am like, I want to be friends with y'all and hang
Yeah.
out because y'all are so cool. So tell us about your company and kind of how you met and what led you to start Good, Better, Best.
Yeah. So I'll say about the company and you can talk about how we met and we'll back and forth. So the Good, Better, Best is what it means is good for our good for the planet, better for our communities, and best for you. So you can see in the back, good is, the planet. We think about like the impact that we're making on our world. We want to also help our communities. So the whole company was built off of what is something that we can do that actually makes it easier to live a little bit better, to make some better choices in a world that's full with so much information and so many different products to choose from. So we both curate and we source and directly deliver any home and personal good products to you. So in the Nashville area, we also have an online store. And it's anything from your makeup, your skincare, your laundry soap, your cleaning products, candles, food storage, all of the things that go in, on, and around your body, except for food. We don't do food right now. So that's what we do. And we want to make it easy. We both have very busy lives. And so we wanted to find a way that we can take one activity that you have to do all of the time, like you need toilet paper, you need paper towels, you need soap. And so we do direct delivery and refills to your doorstep.
So we met, oh goodness, we met about 5 years ago, actually at a photo shoot for young breast cancer survivors. The photo shoot was called Glitter Tits, and it was a topless, like painted body art. And the tagline was, "It's not your grandmother's breast cancer." So they
Love it.
it was a whole room full of young breast cancer survivors, and just really wanting to call attention and awareness to the fact that younger and younger women are getting diagnosed. And we met there, and after
Without shirts on. So we got comfortable with each other really fast.
Quick way to form a friendship. When you're both
the
Right.
fastest way, I tell you. It's
topless and glitter. That's right.
exciting, honestly.
really forms a bond.
We went to, after the photo shoot wrapped, like went to a happy hour, and kind of like the rest was history. Like this was actually right before COVID hit. And so our friendship kind of developed throughout COVID, like
yeah.
over Zoom. And then, yeah, just became really good friends. And, the idea for Good, Better, Best, Angela had kind of had some ideas. And then, we were kind of talking about, well, how can we, knowing that we have this common bond and this common shared experience of trying to make better choices about the products that we're bringing into our homes, like how can we kind of pay that forward? How can we share this information and this story and this journey with other people? And that's kind of how Good, Better, Best was born.
Yeah. And so from the name perspective, I learned this quote, which you may have heard, good, better, best is good, better, best, never let it rest until your good is better and your better best. And so we talked a lot about products and how do we make choices that are, sometimes they're good, sometimes it's better, but we can't live in a world that we're always, we're not zero waste, we're not zero toxin. We can't, that's just not reality for us. And so that's why we have this quote behind us and know that, every day will be a different decision, but we just want to make it easy to make better choices where we can.
I love that. And so were you, Angela, was this something that you were really interested in before your diagnosis? Or is this just once you were diagnosed, you started really delving into kind of the products in and around you?
Yeah. So for us, it's a little bit different, but for me, I hadn't really paid a whole lot of attention to it. I always, like, from a planet perspective, was semi-conscious, but really didn't know anything about what was in our products and what I was using on a daily basis. I had someone say to me the day after I was diagnosed that I gave myself cancer because of things that were in my home. And it was not very nice.
Wow.
But it's not true was the whole crux of the matter, right? It's not true that I gave myself cancer. I did not.
Yeah.
Rather, it did help me to learn about what I had in my home and where I could make some choices that maybe it wasn't necessarily about cancer, but it was just better for my health in general.
Yeah.
And
Right.
so I started talking to others that were in a similar situation. And the first thing I changed was my skincare. Just thinking about what was in my makeup, probably all of it was expired anyway. So started there. And, after I met Erin, she introduced me to some better products, and that's what we really got going on. And so for me, it was a whole different journey, but I started working on it at that point. And here I am 8 years later. So.
I would say my journey for like cleaner, safer products probably started when I first started having kids, and I just kind of started becoming aware of like, oh, the cleaning products that I'm spraying on the floor that they're crawling all over, like maybe I should think about what's in those, or like the sunscreen that I'm literally coating them in head to toe, like maybe we
Yeah.
should think about that, right?
Yeah.
And so it was like I was kind of dipping my toe here and there, and it was just, I would come up with something that, maybe was cleaner or safer, but it wasn't something that kind of like dominated my every thought. It was just like, oh yeah, maybe I'll think about this or that. And then after my diagnosis, with knowing that there was not a genetic marker for my breast cancer,
Yeah, same.
I really started deep diving in, okay, well, what are the environmental factors then? What things can I control? Our environments are so ubiquitous with toxic chemicals. They're everywhere, and it's impossible to avoid them. But what things can I make more intentional choices about, so that I am limiting as best as I can the exposure to things that are controllable?
Yep.
And so, yeah, just kind of started diving in on things like cookware and skincare and laundry detergents and all of the things.
Right.
One thing, Lynn and I both have the opportunity to facilitate small groups with that emotional wellness component that I talked about at the beginning of this banter with bra groups. And we've done some together and we've done some separately. But one thing that we hear a lot from people is just that, like, what did I do? What did I do to cause this? And that's a rabbit hole that's really not healthy. And we try to provide some skills to learn how to um, move on from that, and just like, here's where we are. What can we do moving forward? And it sounds to me like, for me personally, I feel like some of these choices, it's empowering to feel like you've
Mhm.
made a choice based on what you can control. Just like what you said, like there are some things that we can't eliminate all plastics. We can't eliminate, there's some things we cannot do in the world that we live in. But I just think it feels good to be making choices based on what I think is best for me and my family.
Right.
Gives me a little bit more autonomy in the situation.
And I think what is really challenging is, to Angela's point earlier, like kind of sifting through all of the information that's out there and all of the products that are out there. And so what we provide the products that we use and trust and love. But we also provide consultations, because we know that it's really difficult to know how to make better choices. And so I just wish that there had been kind of a guidebook whenever we were kind of starting that journey. And so that's something that Angela and I do, where we do consultations. We help kind of audit all of the products that somebody's using in their home, and help develop, based on their preferences, recommendations for like a tiered approach or like an all-in. Just kind of depends on what people are looking for. But just to be that like guidance, because it is so hard to sift through.
Yeah.
That's
And
really
then that reference point when you need something new, you're like, oh, I now need this and I don't have the time to do the research and I don't know what to buy, then our clients can reach out to us and we'll do that research for them, and already have like the background of where to start. And so like I said, it's all about making it a lot easier, because time is something that we have a very limited amount of.
Yeah.
Exactly.
Yeah.
So in terms of when you were deciding which product lines you wanted to focus on in your business, like in terms of what's online and what you wanted to be stocked, you decided to pick like skincare, you have makeup, right? Cleaning products. Where did you draw the line? Like, did you?
We haven't.
I don't know that we've reached a line yet. It's kind of a constantly expanding product line. At this point, we're still very new. So we launched officially in October of last year.
We just hit
So
6 months.
yeah, we just had our 6-month birthday.
Congratulations.
Oh, yeah.
And so we, at this point, are again just kind of always evaluating what things we might want to add, based on what we're hearing people like ask for, or things that people are saying that they're using a lot in their homes. And so
Okay, so it might expand over time.
oh, absolutely. I just ordered new products today.
Yeah.
And is everything items that you use like on a recurring basis? Like I looked at your website and I saw the most amazing silicone food covers. I had no idea that was a thing. I've never
Yeah.
even heard of them. Like instead of having plastic wrap and I think foil,
Yeah.
you can
Yeah.
put them like on top of things. It's genius to me.
Yeah.
But like I always wonder about my cookware.
Mm.
Like
Yeah.
you use it all the time. Now that's an area you're not in. Like, do you think maybe eventually you will
Yeah.
expand into?
So we have cookware that we'll recommend. We don't actually we just don't stock it today.
Right,
But
yeah.
absolutely. We will at some point. Like we just got into all of the glass storage containers.
Uh-huh.
We kind of started with your every single day use stuff. And also we wanted to see what our customers wanted the most of, because a lot of folks already have those staples in their home. And so we're going off of demand as well. But there's really no product that's off limits.
Out of bounds,
Yeah,
right?
you
Yeah.
could,
Right.
you could use
And,
them.
I just
and we
feel
have
like
the majority of our products online. I'm sorry.
But not everything.
Yeah,
Not
not
everything is
everything.
online. We do have a certain selection of things that are only available for like local clients. So we do for like our refill delivery or for again, just local customers that they could place then an order offline that we can then deliver to them. Yes.
But right now you're saying it's personal and home goods. It's kind of how you're phrasing what you're offering. Is that about
Yes.
right?
Majority,
Yeah.
And tell me more about, because both of you now have mentioned the refill service. Is it like a membership model or how does that work?
Yeah.
Yeah, so it is a monthly membership model, because that's what we find the majority needs a refill on. And so it is $30 a month and will come to your doorstep. So we have these really cool, actually paper bags, but they're washable and refillable. They're awesome. And you put that on your doorstep with all of the containers that you need refilled. And then we'll come by and we'll refill all of your paper products. So we have toilet paper, paper towel, tissue, and then we'll bring all of the other products that you need as well. And so we do that. And then we also have a full service like in home. So if you don't want to have to go through your home and collect your containers, we can come into your home and just like you would have a cleaning service, refill all of your items. And so our refills are also growing as we go. We just started refilling our skincare line. One thing that we did try to do when we first started was evaluate local products. So if we could get it locally, and we tested the product and it would work for us. So we have an incredible skincare line that is local here in Tennessee, Imogene & Co. She makes her products right out of Clifton, Tennessee. But yeah, so our services are doorstep, they're in-home. We have some folks who really just love to come chat and come see us on the weekends. And so we have a warehouse on the west side of Nashville. And so you can come out, refill in person, shop in person. We're starting to host events. We just did a big spring swap where if you brought the clothes that were gently used that you want to share with others, you could bring your clothes, get a discount. And then I have racks of clothes, but we have had a ton of people come by and take clothes and do some shopping. So we have just a variety of ways that you can get the products or select a service.
I love that. Well, y'all are, so I know, I think from your survivor stories, I know, Angela, you're a chief people officer with a school, and Erin, I know you're a mom of 3, and also I want to say a speech therapist. Is that correct?
Yep.
Correct, Tom? So both,
Yes.
so this good, better, best is your side hustle. When do you guys sleep? When do you sleep?
We take turns. Yeah. That's why we're going slow to go. We're going slow to go fast. We have
I think you need to add
and-
some coffee to the line.
I was gonna say.
That should be the first food
Some
item.
clean
maybe.
coffee. Right.
And if you add wine, Jahan and I will come out on
Yes.
a Saturday.
we definitely always have bubbles at all of our events. Our
Love it.
here.
Love it. So how do people, would you say so far, I know you're 6 months into this business, are your customers mostly cancer survivors? Is it a mix of people? How are people finding you, and what's the demographic of people that are finding you?
I would say the vast majority are probably not cancer survivors.
Mhm.
They are people in our communities who are just interested in living cleaner lives, having cleaner options with the goal of reducing their toxic load so that hopefully they never have to become cancer survivors.
Uh-huh.
I would say the vast majority are like business women, moms, people who have families, who are just interested in making sure that the products that they're bringing into their homes are, again, not going to contribute to additional risks.
Yeah.
Mhm.
It's really neat. Well, thank you.
And so just like Lynn asked Candy about ribbons and roads, we would love to know, what's your vision? Where do you see good, better, best in 5 years?
Yeah.
We'll let the visionary answer.
like I hired a robot because you're not
Yeah.
sleeping anymore.
Well.
Yes. So we plan to get on the road. So hopefully Candy will be able to park next to you sometime. So we are
Come on.
in the short term, we're planning on getting a mobile unit. How some of this started was like, how do we start to educate? You talked about knowledge, right? Knowledge is such an important thing for individuals, either just in any case, right? Like this, if people don't know about what's going in on or around their bodies, then they're not going to be motivated to make different choices. And so this kind of started with how do we get into educate college students or young individuals. And so there's aspects where we will have events in the future, but we really want to start with a mobile unit that helps us to ease the service process, get out there into our communities, set up shop right where you are. So to meet people where they are. And then in 5 years, oh goodness, hopefully we have storefronts and multiple locations and all of the things. Not that this is going to be aired. I will plan on being a pupil officer forever, but this is our passion. I mean, we
serve good, better, best.
That's right. You might be
Yes,
able to
yes.
do
So I think we just want to impact as many lives as we can and just make it easier to educate yourself and to make different choices about what you're bringing into your home.
Yeah.
Yeah, so good. Well, you guys,
Those are
all of you
awesome
ladies are doing
plans.
great work. We are so grateful for you and thrilled to be able to um, refer our community to you when we hear of needs, because that's something that we do all day is talk to, newly diagnosed breast cancer survivors. So I really appreciate it. Why don't y'all go back? Candy, will you please tell us how people can find you, and then same for the Good, Better, Best girls?
Sure. Sure. So I've got a website. So it's ribbonsandroads.com.
Okay.
So, and they can actually shoot me an email on there as well. They can subscribe. Look at my website. It's just got all my information. I've got a phone number, fax, email. They can text me to make an appointment or just get additional information.
Okay, awesome.
Thank you.
Oh, I've also got a Facebook page. It's not great. I'm getting that fixed soon. So but I'm working on the social media side of it as well.
Yeah.
All
well,
good.
It's
Okay.
hard to do everything.
That's right. You're a one-woman show.
Yeah.
All right.
Our website is mygoodbetterbest.com. So you can get in contact with us there. You can shop there. You can request consultations there. All of that is online. And then we also do have an Instagram page, which is Live My Good Better Best. They're on Instagram.
Okay. Well, if it's
Awesome.
okay with each of you, we're going to link your websites to this
Absolutely.
recording so that it'll
Sure.
be easy if people go to our website, then they can go to yours just by one click.
Yeah,
But
great.
you also heard it, what the different websites are. So go find these amazing survivors who are doing great things. So we appreciate you guys. Thank you so much.
Thank
Thank
you.
you.
Thank you.
Have a great afternoon.
Okay.
Thank you. You too.
Yeah.